Hello everyone, welcome back to my channel. I am Soumya Tiwari and in this video we will be learning about glenohumeral joint. So this is the part 2 of glenohumeral joint. So if you haven't watched my part 1 GA joint, you can watch it from my description box. I will provide the link in my description box or in my I button. So we have discussed or already read about its definition, its articular surface, degree of freedom, and its accessory structure, that is labrum, capsules and ligament. We have discussed all this in part 1 GH joint. So in this video we will be starting from movement or motion which will occur in GH joint, and we will be learning about stabilization, static and dynamic. So let's start it. So we are starting with first movement, that is flexion and extension. So first we will be doing in which plane flexion and extension occur. So in which plane flexion and extension is in sagittal plane. Both are in sagittal plane. Now what will be the axis? So if there will be sagittal plane, so the axis will be always be frontal axis. So what will be the flexion range of motion? It is about 0 to 180 degree. First see the flexion, then we will see the extension phase. So range of motion is 0 to 180 degree in flexion. So now the muscle which will be helping in doing flexion. So there are three major muscles which helps in doing flexion is your PCM, pectoralis major, anterior fiber of deltoid and coracobrachialis. So the head of the humerus is convex and it is articulating with concave part of your glenoid fossa. So in flexion what is occurring? Rolling is occurring anterior direction. It is occurring in anterior direction, but in flexion the head of the humerus is gliding posteriorly. That's why is rolling occurring in anterior direction. So this is about the flexion. So now we will be moving on extension. So as we have already discussed that it occurs in sagittal plane and it has frontal axis. Now what will be the range of motion? So range of motion will be 0 to 35 degree or from 0 to 55 degree approx. So now the muscle which will be helping in doing extension is teres major muscle, latissimus dorsi and posterior fiber of deltoid. So these are all are the muscle which will be helping in doing extension movement. So for the extension, this is the extension movement which is occurring. So the rolling is occurring in posterior direction, but the head of the humerus is gliding anteriorly, and your the arm is going posteriorly. It means it is rolling posteriorly and the head of the humerus is gliding anteriorly. So this is the extension movement of shoulder joint. So the next movement is abduction movement. So first we will be discussing about its plane. So it is occurring in frontal plane. So if you remember, flexion and extension is occurring in sagittal plane and the axis will be there frontal axis, but here is opposite. Abduction is occurring in frontal plane and its axis is sagittal axis. Now what will be the range of motion for abduction is 0 to 180 degree. Abduction is basically the movement of your arm away from the midline. Let's suppose this is the midline and you are moving your arm here. It's your arm, it's away from the midline. So what will be the muscle which is helpful in doing abduction? So supraspinatus, which helps in your movement, ranges from 0 to 15 degree. So supraspinatus is responsible for occurring the movement in 0 to 15 degree. Now the deltoid is responsible for doing the movement in between from 15 degree to 90 degree. Now the serratus anterior muscle, which is helping in your movement from 90 degree to 180 degree range of motion. So this is the abduction movement which is occurring. This is, let's suppose this is your midline and you are taking your arm away from the midline, so this is abduction. So what will be the movement which is occurring on your humerus head? So in abduction, the head of the humerus is gliding inferiorly, gliding inferiorly. So this is the abduction movement. So now our next movement is adduction movement. So in which plane adduction is occurring? So same like as abduction, it is occurring in frontal plane. Now the axis is same, sagittal axis. Now the range of motion is from 180 degree to 0 degree. So what is abduction? So basically, let's suppose this is your midline and you are taking your arm, this is your, let's suppose this is your arm, you are taking your arm toward the midline, so this is adduction. So the muscle which is responsible for making adduction possible is pectoralis major, latissimus dorsi, short head of biceps, long head of triceps, teres major, and coracobrachialis. So this is your adduction. You are taking your arm from here to here. So you are adding something. So it is adduction. So if there is adduction possible, so what movement is occurring on your head of humerus? So let's talk basically about the arthrokinematics rule. So in adduction, the head of the humerus glide is glide superiorly, so this is your adduction. So the next movement is your internal rotation. So this is your internal rotation or medial rotation. This is your internal or medial rotation. You are taking your arm across your chest. So in which plane your internal rotation is occur? In transverse plane. So if it the movement is occurring in transverse plane, so the axis will always be vertical axis. Now let's talk about the range of motion. So it is about 0 to 65 degree. Then the muscle which is responsible for doing internal rotation is subscapularis muscle, PCM, that is your pectoralis major, latissimus dorsi, and teres major. So these all are the muscle which is helpful in doing your internal rotation. Then what will be the glide in internal rotation is posterior laterally. So our next movement is your external rotation. So the plane and axis is same like as internal rotation. Plane is transverse plane and axis is vertical axis. So this is the external rotation. This is the external rotation. You are taking your arm this side. This is your external rotation. So the range of motion is 0 to 85 degree, and the muscle which is responsible for having external rotation is infraspinatus and teres minor. These are the major muscle which is responsible for this movement. Now the glide is anterior medially glide. So now we will be discussing about static stabilization. So let's clear it out. What is basically static stabilization is? So what happen when you are standing stationary? Let's suppose you are standing stationary. So what structure is helpful in making your GA joint stable one? So if you are not doing anything, this is your GA joint. So if you are not doing anything, you are not holding anything, so what structure will be helpful in making your arm or GA joint stable one? So we will be learning about these structures. So the structure is your capsulo ligamentous structure. These are the structure which is helpful in making your GA joint stable one when you are not doing anything. So first is your capsulo-ligamentous structure, then your bony block. We will be learning this structure later on. First let's discuss about this one. So what happen when you are standing straight or you are not doing anything? So you know gravity assist in this direction. Gravity, the force of gravity will always be in downward direction. So if you are standing straight, keeping your arms by side of your body, so the gravity makes your humerus in downward pull or in downward direction. So the structure which is responsible for making your arm in equilibrium state, or which provides your upward pull, which providing your upward pull, is your ligamentous and capsule structure. We have already discussed ligaments and capsule, which is providing your upward pull in against of this downward pull, which is occurring by your gravity. So this is your line of gravity in downward direction because of gravitational force. So this is your downward pull or downward force. Now there must be something which is providing your upward pull. So the structure is your capsular ligamentous structure, which is your RIC, rotator rotator interval capsules. Which structure? Rotator interval capsule, which includes your three superior capsule, superior GH ligament, and your coracohumeral ligament. These three structures is concluded in your RIC structure. So this three structures is present somewhat here, and it is creating your upward pull, and the resultant is occurring in inward direction. This is your resultant, and which prevent your arm to move inferiorly or to prevent inferior translation. So during the time of static stabilization, all passive structures work for this stabilization. Passive structures is your ligaments and capsules. So no muscular force is acting in your static stabilization. So we will be reading three different structures. So we have read about first structure, which is helpful in maintaining your static stabilization, is your capsular ligamentous structure, that is your RIC. Next we will be learning about second method, is your capsules, which creates your intra-articular pressure, that is your negative intra-articular pressure, which is creating by your capsule. So how it's prevent your inferior translation in static stabilization. So let's see. So now the next structure is your capsule, which is creating in negative intra-articular pressure in relation to it creates a, this is your capsule. Let's suppose this is your capsule. I'm just making it in a rough way, which is surrounding your joint. So it creates intra-articular pressure, so which will already create a vacuum in the joint, which will create vacuum in the joint, which is making your joint the stable one when you are not doing anything. It means it in static position. So it prevent the inferior translation, which is afford by your gravity. So the capsule is creating your negative intra-articular pressure, which will already create a vacuum, so which prevent your inferior translation. The third structure which is helpful in maintaining your static stabilization is your bony block. So you already know that your scapula is always be in upward tilt, is in upward tilt. So this is your head of the humerus, so it already create a bony block in preventing your humerus to go inferiorly. So this is your another way to maintain static stabilization by bony block in upward tilt scapula. So this already, you already know that your scapula is always be in upward tilt. So what happen if there will be downward tilt? So what happen if there will be downward tilt? in downward tilt, what happen? The head of the humerus can go easily in downward direction. It will not prevent the humerus to go downwardly in downward tilt, but in upward tilt it already creates a bony block. So let's now discuss about dynamic stabilization. So which all structure is helpful in making your arm or the shoulder joint the stable one when you are moving? So as you all know that deltoid muscle is responsible, anterior deltoid is responsible for having flexion movement, and your deltoid plus supraspinatus is helpful in doing abduction movement. So deltoid muscle is common in both flexion and your abduction. So we are taking here your deltoid muscle in abduction movement. So let's see in dynamic stabilization. So what happened? This is your here is your deltoid muscle inserted in deltoid tuberosity of humerus. So this is the deltoid resultant. So this resultant deltoid muscle resultant is divided into two component fy and fx. These are the two component of deltoid resultant. So if you see, this fy is your rotatory component and this fx is your translatory component. So if you see which component is larger than which component, so fx is very much larger than your fy component. It means your translatory component is larger or greater than your rotatory component. So what will happen if you do abduction? So your deltoid muscle, because of this resultant that fx component is larger than fy component, so what will happen? This deltoid muscle will create superior translation of your humerus head. This deltoid muscle will create superior translation just because your fx component is larger than your fy component. So what will happen before doing complete abduction? Just because of this superior translation of humerus head, if superior translation occur much just before completing your full abduction, so what will happen? It there Here is your coracoacromial arch, so it will damage your coracoacromial arch because of superior translation. So to prevent this coracoacromial damage, there must be something which opposes your superior translation of your GA joint in dynamic stabilization. So which structure is preventing your this much superior translation just before completing your full abduction? Is your rotator calf muscle. So you have seen already that deltoid muscle is creating upward pull. So fx in deltoid muscle is in superior direction, but which all muscle is maintaining this upward superior translation in deltoid? So there are three muscle, that is your rotator calf muscle, that is your infraspinatus, teres minor and subscapularis, is providing or maintaining your GA joint in dynamic stabilization by creating this downward force to maintain this superior movement of your humerus head. So this resultant is your rotator calf muscle resultant, which includes your infraspinatus, teres minor and subscapularis. I have not involved supraspinatus because we will be seeing in individual. So we have only considered infraspinatus, teres minor and subscapularis in this. So this is the resultant of these three muscles. So this muscle resultant we have divided in two component, this fx and this fy. So this fx component, this is your translatory component in downward direction, and this fy component is your rotatory component. So acting in medial direction, which is maintaining your head in medial direction, and this is the translatory component, this fx downward, which is maintaining your deltoid muscle superior pull. So let's see individually supraspinatus resultant force. So this is your resultant of your supraspinatus muscle. So it's this muscle fx is your translatory component, this fy is rotatory component. So this rotatory component is much larger than the translatory component. So if it's trying to keep your glen keep your humerus head in medial direction, or it will create a compressive force so that your humerus head is uh, have a proper contact in glenoid fossa. So in dynamic stabilization, you have considered three resultant force. First is from your deltoid muscle. Next is your from rotator calf muscle, which you have four muscle basically, but in this we have considered it only three: infraspinatus, teres minor, and subscapularis. And the last is your supraspinatus resultant force. So this is all about dynamic stabilization. So I hope I am clear to all of you, and I am ending my video here. So thanks for watching, and please like, subscribe and share. Thank you.